Lindsay Shively, Introduction to Public Speaking. Speech 3, Persuasive Speech. I'm going to ask you to imagine that your doctor told you that your child can no longer eat foods that contain dairy, no longer able to eat foods that contain eggs, and no longer able to eat foods that contain peanuts. If your child eats an egg, has a glass of milk, or eats a cookie from a pan that previously had a peanut product on it, they could have an anaphylactic reaction and they could die. Anaphylaxis is a severe reaction and possibly life-threatening that can occur within minutes of exposure to an allergen. It can be triggered by an allergy to a particular food, peanuts or shellfish, for example, or biting or stinging insects such as bees, or medications such as penicillin, or even latex, a type of rubber many balloons are made from, or a variety of other allergic triggers. When I asked you to imagine that your child can no longer eat the dairy, peanuts, or eggs, maybe you thought, what about ice cream? What about Snickers? Yes, this is hard for us that do not have food allergies to grasp. However, for a growing number of children in the United States, this is their reality. According to a study released in 2013 by the Centers for Disease Control and Prevention, food allergies among children increased by approximately 50% between 1997 and 2011. The number of people who have a food allergy is growing. Every 3 minutes, a food allergy reaction sends someone to the emergency department. That's more than 200,000 emergency visits per year. The U.S. Centers for Disease Control reported that food allergies result in more than 300,000 ambulatory care visits per year. Many of these reactions are from children under the age of 18. Food allergies are the leading cause of anaphylaxis outside of the hospital setting. Failure to treat anaphylaxis within a few minutes with epinephrine could cause death. What can we do? If a child shows signs or symptoms of a life-threatening food allergy, administer epinephrine immediately and seek medical care. It is important to administer epinephrine at the first signs of a reaction. According to National Food Allergy Guidelines, epinephrine is a first line of treatment for life-threatening food allergies. This device is called an EpiPen. It's one of the most common forms of administering epinephrine. The directions are simple, written right on the EpiPen itself, and an injection into the thigh of a child can possibly save their life. If epinephrine is readily available, many deaths due to allergic reaction can be prevented. I'm going to ask you again to imagine that your child has never tried an almond. At school, a peer in your child's classroom brings a birthday treat made with almonds. Your child begins to have an itchy throat, drool, a swollen tongue, and can't talk. You don't like almonds, so you have never exposed your child to them. The teacher calls the principal's office, and then your teacher and child meet them in the hall, and then it is determined to call 911. How many minutes has it been? Enough time for your child to stop breathing. If your child's school had been stocked with epinephrine, they could have administered it and then called 911. A Minnesota law passed in 2013 allows school districts to keep a stock supply of epinephrine autoinjectors. I'm going to ask you, for all children who have allergies and children and families who don't know they have an allergy, that you contact your state legislators and ask that they support funding for your school district to provide epinephrine on site. Under current state law, schools may stock and administer epinephrine, but it is optional, and many school districts choose not to do so because of cost. The Health Day News reported on a study that stated that schools that stocked emergency epinephrine saved lives. The study indicated that epinephrine was used on 35 children and 3 adults who suffered anaphylaxis in Chicago public schools during the 2012-2013 school year. The drug was administered by a school nurse in 3/4 of the cases. 63% of the incidents occurred in elementary schools, and 37% occurred in high schools. The most common cause of anaphylaxis were peanuts, 55%, and fish such as salmon, tuna, and flounder, 13%. Study author Dr. Richie Gupta said in a college news release, "Many children are trying foods for the first time at school, and therefore it is critical that schools are prepared for a possible anaphylactic reaction." In the US, about 15% of school-age children with food allergies have had a reaction at school. About 1/4 of epinephrine injections given at school involve children who didn't know that they had an allergy. Stocking epinephrine is a medical necessity for schools in every state. Dr. Brian Martin from the Chicago school system said, in addition to protecting those whose epi-auto injectors aren't immediately accessible during a reaction, stock supplies have helped save the lives of those who experienced an anaphylactic reaction and didn't have a prescribed epinephrine auto-injector, he said. An example of how the law is implemented is in Orange County, California. Orange County schools are gearing up to stock the EpiPens to meet the laws and new requirements, said Pamela Kahn, Health and Wellness Coordinator for the Orange County Department of Education. Based on self-reporting by schools, in the school year 2013 to 2014, 4,758 prescriptions were written for children with known anaphylactic issues. Under the new law, Kahn said each public school will have 2 packs of EpiPens. Elementary schools will have a junior version and an adult version to accommodate varying sizes and physiques, she said. Contact your state legislators and school administration. Encourage and dare I ask you to assertively direct them to support funding for your school district to have epinephrine on site. It is our ethical obligation to children with allergies, known and unknown. Parents don't always purchase their own EpiPens because they mentally don't want to go there. They come up with the excuse that their child has not experienced a severe reaction so far. But the thing is, allergic reactions are fickle and unpredictable. You never know when they're going to show up. That's what makes epinephrine a lifesaver. If we acknowledge and respect the fact that allergies are significantly increasing amongst our children who are our future, a simple phone call, a letter, a visit with school administrators and state legislation assertively asking to support funding for epinephrine in schools can and will save a life. In closing, I'm going to give you a list of how you can contact your state legislators.